What's going on with Gen Z's health? Studies show that conditions like obesity, hypertension, mental health problems, prediabetes, asthma, allergies, digestive problems, and some types of cancer, such as colon cancer, are more and more prevalent in teens and young adults than ever before. But why? Many Gen Z report social media and isolation as the biggest reasons for their problems. But are we missing out on something here? If we have so much information about health and wellness, how come young people are having more and more of these conditions than ever before? We have to read between the lines to find the answers. The primary cause of our problems as Gen Z is our nutrition. When was the last time you read the label on the food that you eat? When was the last time that you actually understood all the ingredients on those labels? A large portion of the products in the big grocery stores are processed or even highly processed with many additives, and many of the ingredients we don't even recognize anymore. Highly processed sugars, hydrolyzed seed oils, emulsifiers, nitrates, monosodium glutamate, farming with glyphosate, food dyes, and the list goes on and on and on. Consuming those things daily in big quantities harms us in a way that we cannot even understand properly. Big companies profit greatly on those products by diverting our attention from sugar and industrially processed seed oils and demonizing saturated fats as a way to put the blame on something else. When we look at nutrition, we have to look at our evolution over time. Evolutionarily, we have never eaten so much sugar, seed oils, and artificially added ingredients as we do in the modern days. Obesity, hypertension, prediabetes, and others are a direct consequence of the poor nutritional contents of the food that we eat. The second cause is our lifestyle and our environment. The biggest culprit in our lifestyle are addictions of all kinds. With the development of technologies, addictions are more easily accessible than ever, which makes it harder for us to resist them. The most addictions come from social media, adult content, gambling, gaming, and drugs. The majority of Gen Z have had problems with at least one, and in many cases more than one of those. Such addictions are detrimental to our mental health, but also to our overall health, contributing to many chronic health problems. Those addictions also keep us isolated, making us lonelier. Around 50% of Gen Z report feeling lonely on a regular basis. Constant exposure to social media and the internet from a very young age have caused poor communication skills in many of Gen Z. Those bad habits have produced more damage than we can imagine. The second culprit is our environment. I have already talked about the hormone disruptive properties of our environment in 2 previous videos. You can check them out on my channel. To sum it up, the microplastics, the heavy metals, the PFAS, and the other ever-present substances in our environment lead to hormonal imbalances and have a direct link with many reproductive, endocrine, immune, and even carcinogenic problems. New research shows how badly those things affect us, and exposure should be limited. The third cause is modern medicine. Modern medicine has been rapidly advancing, and new technologies and discoveries are emerging frequently. This, however, doesn't mean that the treatment of all conditions is getting better. Modern medicine is very effective in certain areas, such as treating acute and life-threatening conditions, successful surgeries, managing infections, and others. Contrary to those, modern medicine is not so effective in treating a significant portion of the chronic conditions. This is not a critique to the doctors, who are just a small piece in the big machine called healthcare. I'm talking about how the system is set up and the business model behind it. Economically, this model makes sense because the big pharma companies and the big insurance companies are for-profit organizations. Chronic conditions like obesity, hypertension, digestive problems, and even hormonal imbalances provide a steady income from patients every month for an extended period of time, which is great for the big companies that benefit from it. If a doctor improves or even cures some of the chronic conditions with dietary, environmental, and lifestyle changes, that would mean less customers for the big companies and therefore less revenue. Modern medicine saves and improves lives, but in many cases, it is not designed to find the root cause of the problem and therefore the solution, which can explain why more and more of Gen Z are having persistent chronic conditions. In 2026, we have so many different options to choose for our health, our nutrition, and our lifestyle. We don't need fancy supplements or extreme diets. Sticking to an optimal diet, an addiction-free lifestyle, and a natural environment is the best investment we can make for our health. And it will save us a lot of time, pain, and frustration.